Let's take a look at skeletal problems. The craniofacial area is the most complex part of the skeleton, but for the purposes of this overview, we're going to simplify it into 5 key regions: the anterior cranial base, the posterior cranial base, the ramus, the mandibular corpus, and the maxillary corpus. These regions are commonly viewed on a lateral cephalogram. Cephalometric analysis measures the relationship between the regions of a patient's skull and teeth and compares them to population norms. Key sutures and growth sites determine how these regions relate to each other. In a normal or class 1 skeletal pattern, the skeletal regions grow proportionally to each other, forming a harmonious relationship. When these regions don't develop proportionally to each other, skeletal problems occur. A class 2 skeletal pattern often corresponds to a class 2 bite relationship. The maxilla is excessively anterior to the mandible. This could be the result of the maxilla being too far forward, the mandible being too far back, or a combination of both. Likewise, a class 3 skeletal pattern often corresponds to a class 3 bite relationship. The maxilla is excessively posterior to the mandible. The maxilla may be too far back, the mandible may be too far forward, or both. Disproportionate growth in the vertical dimension can also cause problems. In a normal skeletal pattern, the mandibular plane angles downward from the posterior to the anterior. A hypodivergent skeletal pattern occurs when the angle of the mandibular plane is too shallow, and a hyperdivergent skeletal pattern occurs when the angle of the mandibular plane is too steep. Hypodivergent patients generally have short lower faces, while hyperdivergent patients have long lower faces and incompetent lips, meaning that their lips don't make contact while at rest. It's important to identify whether skeletal issues play a role in your patient's malocclusion, so you can set expectations accurately. In cases like these, you may be able to make cosmetic improvements with clear aligners alone, but achieving perfect occlusion is likely to require more advanced techniques, such as growth modification or jaw surgery. In our next video, we'll wrap up this introductory series by learning how to identify problems caused by harmful habits.